Hello and welcome to Federal. There's a rise in conjunctivitis cases in Tamil Nadu. According to the state's Health Minister Subramanian, more than a lakh and 50,000 people were treated for this from the onset of monsoons this year. And Chennai alone sees like 80 to 100 cases daily, and the entire state of Tamil Nadu sees 4,500 cases per day. So this actually has become a new health emergency in the state. So to discuss this briefly, we have ophthalmologist Dr. Ramachandran with us. Thank you for joining me, doctor. My first question to you would be, is this an unusually high number?
I would say this is an unusually high number for this season. Earlier seasons, we haven't seen this high a number, but yeah, this season it seems to be higher than normal.
And is the number expected to go up in the coming days? And why is it higher this season?
Basically, conjunctivitis is a very contagious disease. It spreads from one person to another person very easily. So if it is rising, it might rise in the next couple of a week or so, and then it will come down naturally. And the good thing about conjunctivitis is early treatment leads to a very short duration of the disease. So as high as the number of cases go, they will quickly fall down also.
So conjunctivitis can be actually viral or bacterial. Can you please explain the differences and starting from symptoms, treatment, and other care?
So, conjunctivitis can be both bacterial and viral. The one commonly known as Medrasai is a viral kind of a conjunctivitis. So, the main difference between the viral and the bacterial is the discharge. Discharge is basically the yellowish thing which comes out very frequently. So, if the discharge is more and if the swelling, if the eyelids are swollen more, then it becomes a bacterial one. Whereas in a viral conjunctivitis, the discharge won't be that much. It will be mainly redness, pain, and watering of the eyes. So that's why Madras eye, which is a very common disease, which is known to in our population, it's a viral disease because it doesn't have much of a discharge. Even in the recent spike of the cases, it is mainly viral. Very few bacterial cases we see. So basically, the main difference in the treatment is the antibiotic will be used for a bacterial one, whereas a viral one mainly you need to give lubricants, and the antibiotic is given only as a cover to prevent a secondary bacterial infection. So the second most important thing is bacterial conjunctivitis can lead to corneal ulcer, which is a sight-threatening complication. So in case of a corneal ulcer, there might be sudden drop in the vision. Earlier, it will be only pain, watering, and discharge, and suddenly the patient will start seeing things very hazily. So that means the cornea is involved. So that becomes an emergency to treat. So that happens less in viral conjunctivitis and more in bacterial conjunctivitis.
Doctor, you just spoke about corneal ulcer. So can conjunctivitis actually lead to any other serious complications?
Conjunctivitis by in nature is a very self-limiting disease and a mild disease, provided you take the treatment from the doctor at the right time. If you ignore your symptoms, then it might need to something like a corneal ulcer or a corneal opacity, which might need to permanent reduction in the vision. But as such, if you take your treatment at the right time and if you rigorously follow the antibiotic course or the medications which we give, it will be over within a week or so.
Conjunctivitis now being this common in the state, people might tend to go for self-medication or use medicines prescribed to other family members. So, is medication for conjunctivitis subjective from one person to one to another person?
Yes, because even if in case of a corneal involvement, that earlier stages of the corneal involvement will not be that visible from the patient's point of view. So self-medicating is harmful. So he has to show to any ophthalmologist, and first we will see whether the cornea is involved or not. And based on that, the treatment totally changes between the two, and the frequency of the follow-up or the patient visiting us also changes between the two. So I would always advise that the earlier you come to us, the better will be the treatment and the more smoother will be your recovery.
Doctor, my last question would be can conjunctivitis be prevented?
Conjunctivitis is basically a disease of the fomites. Fomites being if you an infected person touches an object and another person touches the same object and touches, that's how conjunctivitis spreads. So basically, cleaning your hands frequently, or ensuring that you don't touch that many objects in the environment or in the public use, or cleaning your hands with any alcohol solution frequently, that will prevent you getting a conjunctivitis. And also, do not rub your eyes in case with your hand or with the palm whenever you have any irritation. Best is to show to any doctor and prescribe any lubricant that will prevent the conjunctivitis from ever happening. So that these are the simple ways in which you can prevent yourself from the conjunctivitis. And for a person who is having conjunctivitis, the most important thing is not to touch any objects in the public which other people might be touching, because that's how you spread conjunctivitis to other people. So always use a tissue paper to wipe off your discharge and keep putting regular medication. And those are the simple techniques in which you can also prevent the conjunctivitis from spreading to your near and dear ones.
Thank you for your time, doctor. So, viewers, as per the medical experts' advice, please visit your doctor once you or your family members start to exhibit symptoms, and do not go for self medication. Stay with the Federal for more such updates.
Subscribe to the Federal's YouTube page for more interesting updates.